Hello, and welcome to Breathe In, Breathe Out, Tips for Modern Parents, brought to you by Sanofi, the maker of Beyfortus, nirsevimab-alip, 50 milligram and 100 milligram injection, a preventive antibody that can help protect your baby against serious RSV lung infection. It's for babies under 1, born before or during their first RSV season, and certain kids up to 24 months. Your child should not take Beyfortus if your child has a history of serious allergic reactions to nirsevimab-alip or any of the ingredients in Beyfortus. Stay tuned to hear more important safety information about Beyfortus throughout the podcast. I'm your host, Kimberly Justice. In this series, I'm talking with parents and healthcare professionals about navigating life with a newborn, and along the way, we hope to create a sense of community and connection so you feel supported throughout your journey to raise a happy and healthy child. Today, we're unpacking your baby's 4th trimester, those first few months of life. What's at stake and how to navigate it. So let's go. As a mom of older kids, it's been a while since I was in that little bubble of the first few months with a newborn, but I do remember it well. Joining me today, 2 parents who have more recent experiences with this vulnerable stage in parenting. So on the panel today is Kyle. He's in law enforcement in Tennessee, and Kyle and his wife have a 2-year-old daughter. Welcome, Kyle.
Good to be here. Thanks for having me.
Also joining us is Laine. She's a child psychologist in Portland, Oregon. She is here today in her role as a mom to a 5-year-old son and a 2-year-old daughter. Hi, Laine.
Hi, Kimberly. Thank you so much for having us.
The Breathe In, Breathe Out podcast is sponsored by Sanofi. All of the guests on the podcast are being compensated for their time. Okay, so the topic of this episode is the 4th trimester. So when we're literally speaking, it's those first 3 months of your baby's life outside of the womb. Now, not many people have heard this phrase until they become new parents themselves. So, Laine, what is your understanding of this time period?
Yeah, I think to me, it really strikes me as kind of the idea that in those first couple of months, the baby's really not fully formed. They're not really ready for the world yet. And kind of in a similar vein, you're not really formed as a mother. You're not really formed as a father or as parents. It's a very vulnerable period for that reason. And I think because of that, there's a really continued need for a lot of support and a lot of extra help, and especially resources that not everybody has access to.
That part about the mother or the parents not being fully formed, that's really an interesting addition. I really hadn't thought of that before, but you're right. Kyle, what was your family's experience of your daughter's 4th trimester?
So our daughter actually, speaking of not fully formed, she arrived 3 months early.
Wow.
So we actually kind of substituted the last trimester with the 4th trimester, if that makes sense. She was born without normal respiration. She was 1.5 pounds when she came out. And needed immediate intubation and life support. And she had a 3-month NICU stay. And through all that, we really spent a lot of time digging in and finding help around like online forums and as well as people who live locally that are family and friends.
Kyle, can you tell us a little bit more about that, about the help that you got from that online community?
Yeah, so I'm kind of one of those in the generations where we learned how to live online a little bit more than others. And one of the things that I found helpful was finding an online community in kind of a forum setting where you could talk with other parents. We found a particular group that was specific to parents who had kids in the NICU. And there was a lot of good information there that I had absolutely no access to anywhere else. And there are a lot of things that people just don't tell you about when you have a kid who's in the neonatal intensive care unit. Some of the things that you learn, like how to advocate for your child when you're dealing with doctors who are way, way more informed than you are on a lot of different things. Kind of having to figure out how to play catch up, how to understand what's going on, and how to still make decisions that you feel are right for you and your family. And it can be really difficult.
I'm sure, especially when your partner's recovering from that delivery as well.
Yeah. She had a C-section. It was actually preeclampsia that precipitated everything. And on top of that, Callie was breech. So she had the typical horizontal incision externally, but then internally she had a vertical incision. So that complicated things even more on her recovery. So it was a bit of a whirlwind starting out and really hit the ground running.
Absolutely. So no matter the circumstances of your baby's birth, those new parents really need that new information. They need support and they need community in those early months. Laine, what was your experience with all of that?
Yeah, I mean, I think with my first child, it was a lot more different and a lot more challenging than I had kind of anticipated because
Mhm.
of COVID. He was born right in the midst of all the COVID shutdowns, not a lot of places to do, not a lot of people to see, very different than I had envisioned it. And because of all of that, I spent a lot of time alone inside my house with a
Ooh.
brand new baby who I was trying to learn how to take care of, which is just not a great recipe for success for a new mother's mental health. I remember I had never had coffee, never a regular coffee drinker. And I started going to drive-throughs to get coffee just to be able to see someone during the day and be like another adult person I
Mhm.
can talk to. And I did find, like Kyle, I found a lot of support online as well, since that was obviously the most accessible way to get access to a lot of people at that time. Also, my doctor, of course. My son was overall a very easygoing baby, but he did have periods of just inconsolable crying, which, when you're by yourself, especially if you have a partner who's working, when you're still learning, it makes you feel like a failure. You don't know if that's something that is common or if you're just doing something wrong. I think because of that experience, when I had my daughter a few years later, I really found I needed to keep my routine and some semblance of normalcy, in a way that I think was different than a lot of people. Like, within a few days of her birth, I was taking my son to his daycare
Mhm.
in the morning and getting back in there. And I just found, for me, it was so important to me not to be isolated again, to be able to get back out and involved, and seeing people was really important for me to feel good again.
Yeah, that's a huge transition to make, to bring home that second child and have it all work and mix in together. So, Kyle, 3 months in the NICU, what a tremendous experience that must have been. Um, you all go home, and it's that your daughter's actual, fourth trimester. How did that go? What was that like?
We had a little extra stuff thrown in there, things with bills,
Oh
dealing with
gosh.
insurance, disability stuff, tons of extra doctor appointments. You already have your standard appointments with your
Hmm.
pediatrician. We had multiple appointments with specialists as well, and there was a lot to juggle. Other difficulties, she had acid reflux, again, likely caused because of the prematurity. So feeding was really difficult, getting her to be able to hold down bottles, which added more doctor's appointments. It was very loosely
Hmm.
controlled chaos, and it was really good to have people that you could lean on and say, hey, like, what am I even supposed to be doing here? Uh, finding out sleep schedules, who's going to sleep when, who's getting up when, how much is too much with my wife pumping when she's still trying to
Hmm.
recover and still getting up, and everybody needs sleep, so we have to make sure you're not losing it
Yeah,
completely.
no, that's
Mhm.
So
you're absolutely right. No, sleep is one of those things. The dishes can pile up, and so can the laundry, but at the end of the day, you
and they
literally need
will.
that sleep. Yeah, it's got to happen.
Yeah.
So, Laine, the brand new immune system, it can be so fragile in those first few months. Among other things, the baby's at high risk for respiratory syncytial virus, lung infection, or RSV. So, how aware were you of that, and what kind of concerns did you have?
I mean, I knew that RSV is a
Hmm.
respiratory virus, and I knew that most cases are mild, but it can be serious as well. So it is a fear when you have such a little baby, because it could become an emergency if they get a serious RSV lung infection. So I think there was some fear with that as well. When my son was born, like I said, wasn't much of a concern because we were still in lockdown. So he had very little, if any, exposure to illness. He wasn't really exposed to other people
Sure.
at all. With my daughter, completely different world, because not only was she in a much more open world, she was the second child, and I had a 2-year-old germ
Right.
factory coming home every day. Logistically difficult, or some may say impossible, to actually protect her from those illnesses that children commonly get exposed to. So I did ask her doctor about Beyfortus, and I got it for her as soon as I possibly could. She was born in April, and it became available through our pediatrician in October, and we got it immediately when it came into
Okay.
the office.
And so, Kyle, Beyfortus, a shot that can help protect your baby against serious RSV lung infection, it was around when your daughter was born. How did you learn about it?
So a few months after we got home from the NICU, initially she wasn't on oxygen support at home, and she was doing pretty well. But then she got just the common cold, so rhinovirus, and most people have had that, just kind of miserable, but no big deal. Well, it tanked her immune system to the point where she actually ended up on home oxygen. So she ended up on home oxygen and stayed on that for a while. But when that cold hit her, we started going, we really need to start moving a little bit more heavy-handed, if you will, on making sure that we've shored up our defenses against things that might be a threat to her. RSV is obviously one of those things that came across the radar. We were with our initial pediatrician, and communication just wasn't working well there, and we felt like it wasn't maybe the best fit for us. We ended up with a pulmonologist who made it to where we got on that home oxygen. So the NICU was really good training for that, because we learned how to talk to doctors. We learned, how to communicate appropriately with medical professionals, even if we're not medical professionals ourselves. We ended up finding a pediatrician that worked much better for us. Communication was much easier. It just seemed like a much better fit. And that doctor is actually the one who introduced us to Beyfortus. Our doctor explained that serious allergic reactions can happen, and there are possible side effects of Beyfortus, such as rash, pain, swelling, and hardness at the site of the child's injection. We also discussed the serious lung infection that infants can get from RSV and how Beyfortus works to help prevent that. We weighed all the benefits and risks. We did some of our own research, then made our decision on getting Beyfortus for our daughter.
So, Laine, another component to your baby's 4th trimester, as you had mentioned, is the emotional well-being of the mom. So, how's she coming into this role? Some women will get postpartum depression or PPD. Others might have postpartum anxiety or PPA. How did you navigate those aspects in those early months?
I mean, I think it's really tricky because there's a lot of talk when you have a new baby about it's normal to feel overwhelmed, it's normal to feel anxious, it's normal to feel down. People talk about, hormones, the big adjustment. And I think because of all that, it can be kind of hard to know like what is a normal level of those things. And I think in hindsight, I think I did have PPA with my son, but I think at the time I was like, oh, it's normal to feel a little anxious, it's normal to do these things. And eventually when I had more contact with people, I realized, hey, you know what? This is actually more for me. And maybe I should get some support. And I think I would really just say about that, if you are struggling or you have any concerns, or even if in your head, if you're asking yourself, maybe is this too much? You should talk to your doctor and get some support because it's not worth struggling.
Yeah, learning to trust yourself as a new parent and trust those instincts. It can be hard,
Absolutely.
but man, you should also trust yourself if you think you're having those issues. So was talking about postpartum depression or anxiety something that your gynecologist or your pediatrician raised with you?
Yeah, what was kind of interesting, my gynecologist did have some screeners for it. Our pediatrician's office actually does a full postpartum screening on mom at every single one of those early visits, every single time. And I remember thinking it was interesting that I was seemingly getting a higher level of care from my child's pediatrician than I was from my own doctor, which I thought was really interesting. But I appreciated it though, because regardless of where it was coming from, there were people checking in. There were people kind of looking for that and trying to get some feedback about how things were going for me.
Kyle, any final thoughts on what parents and infants need in that 4th trimester?
I think one of the biggest things that helped us was having a good relationship with the doctors and the providers that we had for our daughter, Callie. It's really important to be able to have that dialogue and to really have clear and open communication, and to have a doctor that you feel you can trust with information, who's willing to give you information and make sure you maintain that open dialogue. And along with that is having, the strength and the confidence to know that you're the parent and you can and should advocate for your child when it's necessary.
Laine?
I would definitely say having a really good relationship with the physicians and support team you're working with, pediatrician, obstetrician, having good relationships and feeling comfortable with those people and having that trust, I think is so critical. I totally agree. I think generally emotional and interpersonal support from a range of different places, online, in person. I think certainly if there is a partner, I was lucky to have my husband who is a wonderful supportive partner and able to help in many ways. And I think having someone, anyone, even if you don't have a co-parent or a partner there, having somebody who is on your team and someone you can reach out to, maybe hopefully be able to see, spend some time with. I think having those connections in real life as well as online is so huge in helping heal.
Yeah, finding that support is so important. Absolutely. Well, one final question I know I have is I want to hear how all the kiddos are doing.
So Callie is going to be 2 this December. She is still very small, but otherwise she's doing really well. She's meeting all of her milestones. She is absolutely wild. She has a crazy personality. She's bouncing off the walls. I've never seen a personality that strong in a tiny little package like that. But she's actually got her last specialist appointment coming up in about a week, and that's her pulmonologist. And hopefully they're going to cut the strings there, and then we're just going to be on the pediatrician alone, and that is really good.
That's fantastic.
That's awesome, Kyle. It was really good to hear that. My kids are also doing great. My son Oliver, who I feel like was just born, is somehow now 5. He turned 5 and started kindergarten on the same day.
Nice.
Really exciting, and he's doing great, loving kindergarten. His little sister is almost 2.5. And she is also doing awesome. She hangs off his every word and does everything he does. He is her favorite person in the world, but she's got a great Spitfire personality as well. So she's a treat to have along for the ride.
That's awesome. Well, as a little sister, 2.5 years younger than my older brother, that stuck around.
Yeah.
So. Well, thank you, Kyle. Thank you, Laine, for joining us today. Really appreciate you taking the time.
Thanks for having us on. It's been a pleasure.
Thank you so much, Kimberly. Appreciate your time.
To hear all the episodes of Breathe In, Breathe Out, go to the Beyfortus website. That's Beyfortus. I'm Kimberly Justice. Stay tuned for full important safety information. Important safety information. Your child should not take Beyfortus if your child has a history of serious allergic reactions to nirsevimab-alip or any of the ingredients in Beyfortus. Before your child receives Beyfortus, tell your healthcare provider about all of your child's medical conditions, including if your child has ever had a reaction to Beyfortus, has bleeding or bruising problems. If your child has a problem with bleeding or bruises easily, an injection could cause a problem. Tell your healthcare provider about all of the medicines your child takes, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Your infant should not receive a medicine called palivizumab if they have already received Beyfortus in the same RSV season. Serious allergic reactions have happened with Beyfortus. Get medical help right away if your child has any of the following signs or symptoms of a serious allergic reaction: swelling of the face, mouth, or tongue, difficulty swallowing or breathing, unresponsiveness, bluish color of skin, lips, or under fingernails, muscle weakness, severe rash, hives, or itching. The most common side effects of Beyfortus include rash and pain, swelling or hardness at the site of your child's injection. These are not all the possible side effects of Beyfortus. Call your healthcare provider if you have questions about side effects. Indication: Beyfortus is a prescription medicine used to help prevent a serious lung disease caused by respiratory syncytial virus, RSV, in newborns and babies under 1 year of age born during or entering their first RSV season. Children up to 24 months of age who remain at risk of severe RSV disease through their second RSV season. Please see the show notes for this podcast for links to full prescribing information, including patient information.